Now we're going to talk about heart health because your heart is very important. You got to do what you got to do to take care of it. We've got Dr. Robert Edmonson on this morning, who is a cardiologist. And I think when we think about our heart health, I know we think that a lot of it could be due to genetics. But Dr. Edmonson, you're here to tell us there's a lot more that we can do to help our heart be healthy.
Well, thank you. I appreciate being on your show. And yes, that's absolutely true. And also, genetics is not inevitable. People that have genetic predisposition can certainly reduce their likelihood of cardiovascular problems significantly. And basically, the disease is much more than we appreciate preventable. It requires prevention, and prevention, unfortunately, tends to have a name of deprivation, when actually, when we practice the principles of prevention, we're enhancing our lives. And so prevention, of course, is exercise. That's a very fundamental importance. And actually, moderately vigorous exercise, 30 minutes, 5 days a week, is critical. Of course, we know that blood pressure and cholesterol management is very important, and I certainly believe in that. Stress reduction is underemphasized and extremely important. And then I think the most neglected area, and if you look at our society and all the obesity, nutrition is one of the biggest issues. And principally, unrecognized the value of plant-based nutrition, how that really affects our bodies favorably, and how our typical American diet has an adverse effect.
And when you talk about plant-based diets, I mean, you're talking more than just a salad, right, Doctor?
Yes, I'm talking more than just a salad. And basically things that grow out of the ground. Really, animal and dairy products have some adverse effects, particularly on, I don't want to get too technical, but the lining of our blood vessels, called endothelial cells, and they really are essential to our health, our arterial health, which is essential to our lives and our well-being. And so it's much more plant-based nutrition, and there's actually a lot of information out there about it that allows you to eat properly and enjoy the foods and make the lifestyle changes. But these changes don't occur unless you're educated as to why. So I think that that's one of the critical issues, that people become more educated about the importance of it. And I might add, it's not just cardiovascular disease. It's more plant-based nutrition is important for cancer, dementia, other diseases as well.
We're talking to Dr. Robert Edmonson this morning. He's a cardiologist. You mentioned a lot of things that we can do here: exercise, watch what we eat, stress management. But you also mentioned blood pressure and cholesterol. What do you do if you're doing some of the things you mentioned? You're trying to eat right, you are getting some exercise, but what do you do if your cholesterol is not within the correct ranges? What are you supposed to do from there, and can you manage that without going on medication?
Well, we talked about the ways which you would manage it, and that would be principally more sticking to more plant-based nutrition. But there are people that require medications, and particularly people that I see that have advanced disease to begin with. I want them to do all the things that they can do to stabilize and potentially reverse it. But it's awfully important that they be on the statin, and I'm very much a proponent of that, not just to put people on the statin because, again, I want to emphasize the other aspects. But the statin drugs actually have a very pronounced effect on preventing and even reversing heart disease and preventing strokes. That data is very clear. I know a lot of people are concerned about the side effects. That's overstated in a major way, I believe. Certainly side effects are present. They need to be addressed if they're there. But I'm a big believer that that's important. I might add that I was in practice doing interventional cardiology, put in stents before we had the statin drugs, and it was discouraging to see new disease and new vessels 6 months to a year later. That really has come to a major reduction since we've had the statins.
Oh, terrific. All right. Hey, Dr. Robert Edmonson, cardiologist, thank you for joining us and talking about heart health this morning on Memphis Morning News. Always a good time to do that. Have a great week, sir.
Thank you. I appreciate it.
That's some good information,
Hey, it's Jake. Now, what if I told you
Hey,
could
Jake.
drive...
What's going on, buddy?
I was going to say that's some
How
good
you doing?
information that you can talk to with your doctor, because sometimes when you get blood work back, you're looking at the LDLs and the HDLs, and it all gets confusing, and your doctor can do a better job of explaining to you what you need to do for your, blood work and moving forward.
Yeah, absolutely. It's absolutely good advice, and always good to check with your doctor. 7:52 from the Wolf Chase Toyota Traffic Center. Here's Wendy Hayes.